Bill Maher's magic wand. Banishing hepatitis A once and for all. Bill Maher is a man on a food safety mission. As a lawyer who litigates in food poisoning cases in the US, he gets to meet many victims of foodborne illness and is a passionate advocate for prevention. In a recent blog post, Mr. Maher shared the devastating toll of a foodborne illness outbreak caused by hepatitis A, describing how one infected food worker passed the disease onto nearly 50 people, hospitalising most, killing 4 and causing 2 liver transplants, he said in the blog. Hepatitis A, well, it's not that serious, right? When health services talk about hepatitis A, they often use language that implies it's not a particularly serious disease. Maybe they're comparing it to Hep B and C, which have high rates of serious long-term health issues. Bill's blog post mentions 2 liver transplants and 4 deaths from 50 recent infections. Now, that sounds pretty serious to me. But here is what NHS Inform, a UK government health service, says about hepatitis A. There's currently no cure for hepatitis A, but it will normally pass on its own within a couple of months. You can usually look after yourself at home. While you're ill, it's a good idea to get plenty of rest, take painkillers such as paracetamol or ibuprofen, and maintain a cool, well-ventilated environment. NHS Inform also says that serious complications occur in only 1 of every 250 infections, which is less than 1%. Mr. Maher's clients experienced a serious complication or death rate of 12%, 30 times higher than the figures quoted by NHS Inform. And rates of hepatitis A infection have been increasing in the US since 2016. The impacts of Hep A infections, my family's experience. No matter what the rate of serious implications or complications, any foodborne illness with symptoms lasting for 2 months on average, 2 months, is awful for the victims and their families. My father had hepatitis A when I was a child. He was bedridden and bright yellow for weeks. Even his eyeballs were yellow. 4-year-old me found it scary. Plus, he smelt funny. With him unable to work for so many weeks, we could have faced dire consequences as a family who relied on his wages. Fortunately, we were protected by Australia's legally enshrined sick leave policies, which meant he continued to get paid while he was at home recovering. Not coincidentally, Dad caught hepatitis A while travelling in the USA, a country where most food workers don't have protections when they're sick. If they don't turn up, they don't get paid. This increases the likelihood of infected workers passing their illness on to customers. There's a vaccine already. No magic wand needed. Hepatitis A is one of the few foodborne illnesses that can be vaccinated against. It blows me away that we don't routinely vaccinate everyone in all wealthy countries. But we don't. The UK National Health Service says they don't offer free vaccines for everyone because the risk of infection is low for most people. The Australian government says the same thing. Bill Maher says his top priority, the number one thing he would do if he got a food safety magic wand, is to make it legally mandated for all workers to be vaccinated against hepatitis A. A vaccine mandate would immediately cut out all outbreaks caused by food service workers. Outbreaks like one in Virginia in the USA in 2021 to 2022, which started in a local restaurant when an infected food handler worked with symptoms. The outbreak then spread from infected diners to 98 other people in the community through person-to-person contact. Authorities estimate that the final cost of the Virginia outbreak exceeded $3 million in direct costs of hospitalizations and vaccines that were subsequently offered to high-risk people in the surrounding areas. The cost of lost wages and legal fees was not included in the estimate. That's $3 million from one sick food handler who didn't wash his hands properly after using the toilet. It kind of reminds me of how a sick worker in a frozen berry factory in China caused 11,000 people to get norovirus when the berries were served raw in Europe. And I've got a link to read more about that in the post and the email. And it also ties in pretty nicely to last week's Food Safety Culture Talk, where I talked about how every individual in a food company can have an individual impact on food safety. Is a vaccine the answer? So, is a mandatory Hep A vaccine the answer? The US government included it in the routine child vaccination schedule in 2006, so they obviously think it will help. In my country, Australia, we've had Hep A outbreaks from imported food like dates and frozen raspberries. Vaccination would only prevent those types of outbreaks if people in other countries were vaccinated as well as Australians. Forcing food workers to be compulsorily vaccinated would be really problematic in practice. But I agree with Mr. Marler in principle that Hep A vaccines are an easy win for food safety. The outcomes of an outbreak are so bad, and the prevention, vaccination, is so simple that it's hard to see the downsides to these low-hanging fruit food safety initiatives. How to protect yourself and your customers from Hep A. Hepatitis A is spread via the fecal-oral route, which means infected people who do not wash their hands properly can spread the disease to others. The infective agent is a virus, which is inactivated by cooking, but not by freezing or freeze-drying. To prevent Hep A outbreaks from affecting you and your customers, have a stay away if sick policy for food workers. Educate them on the symptoms of foodborne illnesses, including Hep A, and make sure they feel confident to stay home if affected. Wash hands, wash hands, wash hands. Make it a habit for everyone and enforce it at work and at home. Reconsider the use of imported frozen berries in raw foods like smoothies or cold desserts. And consider vaccinations for yourself and your family, and they're a must if you travel or live in a developing country. In short, hepatitis A is a foodborne illness. There is a vaccine against hepatitis A. Many countries do not routinely vaccinate against Hep A. One infected food handler can spread the disease to hundreds of people, resulting in serious health outcomes and large economic costs. Prevention for Hep A includes vaccination for food handlers, high-quality hand-washing protocols and compliance, cooking raw foods from developing countries before serving or eating. And the main sources for this article are the post from Bill Marler. There's a link to his blog, of course, in the email and the post, and a CDC published article by Helmich published in 2023. And you can learn more. There's a WHO fact sheet on hepatitis, or you can read my write-up on lessons learned from a hepatitis A outbreak in issue 67 of this newsletter.